Cancer treatment. People fear it. Is it still the same or has it improved?
We often see in our practice that people hide and women are not very open to talk about it.
Chemotherapy can be avoided in them also. And breasts will be saved. And it's a very important organ for any woman.
And when inflammation increases, all lifestyle diseases are a platter invitation. Idli, vada, dosa, upma, like that. So you have combo of diseases. You see our patients, they'll not have one disease. Diabetes, hypertension, something else, and then comes cancer.
Self-breast examination is the simplest way to check yourself.
Can you explain in a little bit more simpler way as to how one can do a self-examination?
Breast cancer is the number one cancer affecting Indian women.
Just delivered a baby. She was breastfeeding, and now the question about how will my child live without breast milk.
Hello everyone. A very warm Mother's Day to all you wonderful women who have joined us today and are listening to this podcast. Today we are going to talk something very important, extremely important, but often avoided. Breast health. Breast cancer is the most commonly affecting cancer not only globally, but yes, in India as well. So, we need to know this, that early detection does save lives. I'm joined here by three incredible oncologists, Dr. Shobha, surgical breast oncologist from Kidwai Hospital, Bangalore, Dr. Poonam, medical oncologist from Apollo Hospital, Dr. Srivalli, medical oncologist from Manipal Hospital, Bangalore. So, on a day like Mother's Day, Dr. Srivalli, we would like to know, in fact, from all of you, that what does women's health mean to all of you personally?
Women, symbol of sacrifice, always puts others first. Family, children, work. And unfortunately, her health comes last. So today is a reminder that taking care of yourself is not selfishness, but it's necessary.
That's very interesting. Dr. Poonam, how about you?
On this Mother's Day, let's normalize talking about breast and breast health, because unless we normalize, it's not going to get picked up. So we often see in our practice that people hide and women are not very open to talk about it, and even if they have a lump, they are just not bothered. So let's normalize this, talking about breast and breast health.
Dr. Shobha.
Yeah, absolutely. Whatever my colleagues have told, I agree with that. So women do not prioritize themselves. So their health is the last one. And unfortunately, the most preventable cancer, that is the breast cancer and cervical cancer, are number one and number two affecting Indian women. So why is that? Because, as Dr. Poonam said, it is they don't come out and speak for themselves. What's bothering them? It could be just a breast lump or abnormal discharge, which might be an early symptom. So that should be normalized. As she said, they have to come out and speak whatever is affecting them or bothering them in the early stage itself. I think that women should come forward, talk for themselves, and then change will happen.
Absolutely. I think all of you have put across very interesting perspectives, and we need to listen to our body and come out and speak. So let's start with the basics. How common is breast cancer today in India? How commonly do you encounter cases? Dr. Shobha, if you could just put across your perspective.
So breast cancer is the number one cancer affecting Indian women. So if we talk about in numbers, it will be like 34 to 35 per 1 lakh population.
That's scary.
Yes, so 1 in 9 women, they are diagnosed with breast cancer. And previously we used to say this is a cancer of postmenopausal women, older women. But now the time, over the time, the trend is changing. So it is affecting even the younger women. So we do see the earliest cancer in young women I've seen is at the age of 23. So she was diagnosed at the age of 23 with breast cancer. Yes, and yes, so 35 to 40 year, many of them are being affected now.
Dr. Poonam?
So, yeah, although the numbers sound very scary, but let me tell you, it's not a disease to be afraid of. It just requires a little bit of awareness and having that knowing that whenever you have that symptom, thoda bhi, if any symptom, any lump is there, get it checked, because this is the only organ which is outside the body, and early detection is definitely possible in breast cancer. We just need to be aware, and I think this podcast will help us. So there's nothing to be afraid, because early detection means complete cure.
Certainly. So come out, the lump will not settle in itself. You need to speak out. Dr. Shivali?
So I think awareness is the key for early detection. And early detection definitely saves breast. But not just that, even your treatment gets reduced. So you may not need every form of treatment. Maybe surgery could have been, a cure.
Right.
You may not need radiation, chemotherapy. So you could have, had only surgery followed by maybe some radiation and tablets, and get away with chemo. So definitely early detection is the key. It saves not only your breast but definitely saves your life.
So, if detected early, we can certainly look at treating breast cancer.
Completely, yes.
That's great. Many women have heard of self breast examination, but how important is it?
So, unfortunately, not many women practice self breast examination, but to be honest, self breast examination is the simplest way to check yourself. So, it helps us to notice the change which only you can notice. So, any new change that happens in your body, you are able to detect it and meet your physician.
Can you explain in a little bit more simpler way as to how one can do a self examination?
Usually we say to do once a month, after about a week after your periods, and be comfortable. Look, if you want, you can look in the mirror and you can palpate all the quadrants of the breast. In fact, when patients come to us, we do teach them how to do it. It's very simple, and there are lots of videos they can see. It's very simple. So once a month, 1 week after their periods is the ideal time.
Any changes? Report
They
to
will
your
have
doctor.
to report.
Okay. Doc, what about your perspective on the signs
Yeah.
or the noticeable changes? Which one should, the red flags actually?
Yes. So every day, as Dr. Poonam said, self-breast examination, they will get familiar with their normal breast. So any kind of small change also, they can detect it early, right? So what are the symptoms, signs you have to look in for is, first, front of the mirror or sleeping, and then even during shower, standing position they can do. So see for any kind of disparity in the size of the breast, both the breasts, and then in a circular manner from inside to outside. They can go from the nipple area and to outside, outward, and the axilla. So everything should be examined. Axilla also, underarm, so armpit.
Okay,
So yeah,
here.
yes.
Yeah.
So then they look for any lump, usually which is painless. So whenever they have painful lump or lumpy knotty feel, that is the normal thing what they observe before their periods. But these cancerous lumps are the one which are painless ones, and they can detect only once they start palpating their breast.
Because as we all know, I think it's a common notion that if it doesn't hurt, it's all fine.
Yes, yeah. It is right the opposite in the breast cancer.
Exactly the opposite.
Yeah.
And this is one of the reasons why late detection happens. There's no pain.
So it's absolutely not correct.
Yes.
So even if it doesn't hurt, it is not fine. Yeah.
Most of our lumps are painless.
So look for the lump, and then any kind of discharge from the nipple, or any retraction of the nipple, or any kind of discoloration of the skin, like peel, orange peel, the skin of the orange peel. It might be like that also, and then or any kind of swelling in the armpit. So these are the common.
So some very important, very well said. I think properly put together 5 takeaways, right? Which one should watch out for. Let's talk about screening. We've all heard about mammography. But are there challenges in India, ma'am?
Yeah, so screening refers to detection of cancer even before the onset of symptoms. So, definitely, mammogram is the standard investigation of choice, but there are a few limitations like less than 40 years of age, dense breast, which my colleagues will elaborate.
Sure, sure. Because we also want to know what exactly do you mean by dense breast?
Yes.
Yeah.
So, breast is an organ which is composed of the glandular tissue and the fat. So, based on what is the proportion of the glandular tissue and the percentage of fat tissue, we call it as a dense breast. So, usually in a dense breast, we have more of glandular tissue. Now, what makes it difficult is because of the excess glandular tissue, sometimes small tumors may hide and it might become difficult to diagnose them by the routine test. So, we complement them with a sonomammogram. Mammogram is an X-ray of the breast. Sonomammogram is an ultrasound of the breast. And in some situations where it is very tiny and there is still a doubt in young women, dense breast, then we also add on a MRI of the breast.
Interesting. So ultrasound of breast, mammography, and I think the
In some
third one
cases,
is
MRI.
MRI, right? Doc, when should we actually, what is the ideal um, situation in which one should go for a mammogram?
So, screening, as Dr. Poonam said, it's where all women do without any symptoms, right? It's a general population. So, this all recommendations, most of them, previously we used to say from the age of 50, but then now it has come down to 45 years. And now, because of the age, early trend, I mean, in a younger age, it is seen, even from the 40 years itself, they do recommend mammogram. So here, at least in Indian women, 45 is the age group where we say they should undergo mammogram annually. So every year a mammogram from the age of 45 years.
There is one question which comes to my mind, Doc. So, mammography, if you ask me, out of this doctor's purview, I mean, isn't it painful? I mean, I've heard like
Yes.
many of my friends, of
Yes.
course, not in this medical fraternity, come being scared about mammography and, so is there any newer advancement, or I think how do you complement the other sonographies or MRIs, what we spoke about? Should you go for a sonography first or ask your doctor about something which we don't know?
See, when we say a screening test, it has to give us a good result, pick up abnormal things in most of them if in the population, and it should be economical and it should be easily applied to everyone. That is the basic principle of a screening method. So here, over the years, they have seen mammogram is the best to pick up abnormal, that is microcalcification is what we are seeing. And if you do a routine ultrasound, which is not painful, unlike mammogram, it is not painful, but it might not pick up microcalcifications as good as mammogram. So only in, as Dr. Shivali said, in dense breast, complementary sonomammogram they do, and then try to pick up the abnormal areas there. But as such, as of now, mammogram, though it is painful, I think they say, you take some pain and it will be fruitful for you. So definitely our women, when they can tolerate labor pain, this pain is nothing. So we do recommend only mammogram as a standard screening test for all women above 45 years.
If you could also let us know, like, what are the newer advances in breast cancer screening apart from these 3 screening tests which we spoke about?
There's some newer things coming up because now we are all in AI age. So AI is definitely creeping in the healthcare industry, and there are some thermal scans and AI based driven scans. But if you ask the FDA and the US guidelines, which we all doctor fraternity follow all over the world, they have not been included in those guidelines. So they are often used as complementary and not a standalone diagnostic tool. So the standard is mammography. It's just once in a year, as ma'am told, and I think no pain, no gain. So once in a year, little bit pain.
In India, we do have newer advances.
We do have, but
Okay.
we would still like to go for the standard recommendations of mammogram. We get the Berat score in that very nicely, which is often missed in other kinds of scans. So AI is coming up, but there are some limitations. It's not foolproof.
Maybe in another 10 years you might have
Yeah,
some
we
kind
might
of.
Yes.
have, and maybe definitely these the newer ones can be used as an adjunct.
Complementary.
It will not replace, but yes, it will be an adjunct. And to add on, I think self breast examination is the simplest screening modality.
Yes.
Some mythbusters coming your way. Dr. Shobha, cancer can happen only after 50.
Not at all. Not at all. So we are seeing the change, definitely affecting younger women also. Not only women, we are seeing a slight increase in the male breast incidence also. So even males can get affected with breast cancer.
Interesting. Males can get affected with breast cancer. Dr. Poonam, no family history, no cancer.
So this is the biggest myth. Family history has a role of around 10 to 15%. So there is a mutation called BRCA mutation. So BRCA mutation is associated with breast cancer, but most of the breast cancer patients do not have any family history. They do not have this mutation. So 85 to 90% of them are having no mutations and no family history. On the other side, just because you have a family history, there is no 100% guarantee that you will get a breast cancer. So it's both ways. Family history is not to be given too much of importance. But yes, if family history is there, then we need to be a little more careful in screening tools and be more aware of the body.
Oh, really? Okay, Dr. Srivalli, cancer means death sentence.
An absolute no. I think all my colleagues will agree. So we are in an era of advanced technology, advances in screening, treatment. So definitely cancer doesn't mean death. So we have more and more treatments, the new modalities that are available which we can offer. So I think cancer means death is the biggest myth. So not just that, let me allow to few other more other myths as well. So people think that underwire bras can cause cancer, breast cancer. No, a definite no. Using talcum powder,
No.
absolute no. So even using talcum powder does not cause breast cancer. The other things, people think that okay fine, my my neighbor, she underwent surgery, radiation, chemotherapy, targeted therapy, okay, my doctor will advise everything to me. She got a tablet, why didn't I get a tablet? So I think these are some of the myths which people come with, that okay, this particular doctor is under treating me, I am not getting this treatment, and chemotherapy means okay, my the whole life is done, and I think I'm going to die with the chemo. So I think it's the biggest myth. So chemo is not painful. Talk to your oncologist, speak to your medical oncologist, discuss, because we have better medications to counteract the side effects, and definitely you can sail through your treatment really well and win over and conquer cancer.
Great. And go outright shopping. for
Absolutely, yes,
All
yes.
kinds of bras,
Yes,
all
yes.
kinds of powders. Don't be
Yes.
scared. Just go for screening.
Yeah. And Shreya, I wanted to add one thing.
Yeah.
See, now we are seeing so much of, it's a lifestyle related cancers. These breast cancer and uterine cancers are. But the stress, what we are all into, rat race and, home stress, work stress, everything. I think that also has got a lot of impact on our health. So previously we used to say only hypertension and diabetes are due to stress and eating habits. But no, even cancer nowadays, research has showed that stress is also a etiological factor. It might be a reason for cancer to start. So that's why what we call now immunotherapy and all, it is actually it is against our immune system only. So that therapy. So ultimately, the microenvironment for the growth of the cancer cells, stress also plays a very important part there. So people who are very healthy, some are they're extremes. They think of their health so much, they're under stress. to maintain that health, isn't it? You know, 3 hours, yes, 3 hours, 4 hours of gym. I'm calculating the food and having. So that stress itself might be a kind of reason for carcinogenesis. So I think
Stress actually is a cause of increased inflammation in the body, and when inflammation increases, all lifestyle diseases are a platter invitation. You call it diabetes, hypertension, stroke, kidney disease,
and now
cancer.
cancer also.
So everything, it's a called combo offer. You have heard combo meal, idli, vada, dosa, upma, like that. So you have combo of diseases. You see our patients, they'll not have one disease: diabetes, hypertension, something else, and then comes cancer. So underlying cause, as ma'am said, is stress, which is causing increased inflammation. We need to work on that.
So not only physical health, mental health also is very important.
So, cancer is not the end, but stress is there for us all. We need to know how to manage our stress. I think that stress management will become another whole story. Yeah.
So it's not a full stop, it's a comma.
Yeah. Cancer treatment. People fear it. Is it still the same or has it improved?
So it has improved a lot, because now we are moving from just treatment to personalized medicine. So personalized medicine, because all cancers are not same. In a particular cancer, for example, the breast cancer, all breast cancer patients are also not same. So they have something called ER, PR, HER2/neu, which are simple targets on the tumor tissue. And based on what is positive, what is negative, we have something called as targeted therapy, hormone therapy, or chemotherapies also. Chemotherapy usually will be there irrespective of the hormone status based on their staging. So we are definitely moving from one size fits all that was in the olden era when targeted therapy was not there. Now we have a medicine for each size fit. As you go for shopping, you have apne size ka fit cloth hai. Like that, we have the fitting treatment according to your genomics. So it's targeted therapy, and because it's targeted, and even hormone therapies are just tablets, there are no side effects, better tolerated, and it's revolutionized actually. It's awesome.
Great to know about this revolutionary treatment. Dr. Shobha.
So, as a surgeon, what I see, so we were just discussing about cancer means death, that myth. Why is that come to people is that because most of our patients, they come to us in the advanced stage, locally advanced stage. So, when it is like that, the cure rate falls down. So, if it's early, if it's detected early, first stage or second stage, definitely the cure rate is very high. So here, as a surgeon, if we detect or if it's detected with mammogram, it's before the lesion is developed. If before the woman can feel her lump, we can detect in that level. So if we detect there, the treatment is very simple. It's just, we have to remove that lump with a little margin, negative margin, and then she'll be totally cured and will be preserving her breast also. So breast conservation surgery have become very extremely popular now. So because we are seeing more and more young people getting affected, we want to save their breasts also. So that's why we need people to come forward when it is in the very, very small size itself.
So the initial nascent stage, please come out and open up.
Yes. The treatment is simpler, and as Dr. Shivali said, chemotherapy can be avoided in them also. So, and breasts will be saved, and it's a very important organ for any woman. So, definitely early detection, simpler treatment, and your breasts also are saved.
I think we'll hear from you again, Dr. Shivali.
So let me summarize, So like my colleagues elaborated the different forms of treatment: surgery, radiation, and systemic therapy. Systemic therapy like chemotherapy, targeted therapy, and hormonal tablets. So how do we decide and tailor these treatments? So it depends on several factors, like what is the age of the patient, fitness of the patient, what are the other problems the patient has got, like comorbidities, like Madam mentioned, diabetes, hypertension, and other things, and also the feasibility of that particular treatment, like can my patient come weekly for a chemo, or if he's traveling from far, so maybe I'll have to tailor it to a 3 weekly regimen. And also the stage, So these are some of the factors which we decide to plan the treatment. So suppose the patient has got an early disease, so yes, definitive treatment, surgery, followed by, if needed, radiation, tablets, and chemotherapy. Locally advanced, we start off with the chemo targeted, try to shrink the tumor, and then offer definitive treatment like surgery, radiation, and tablets. So like madam mentioned, we have moved from an era of chemotherapy to targeted therapy, immunotherapy, precision oncology. So we understand the biology of the tumor, the driver mutation, by doing next generation sequencing and understanding what were the mutations that caused this particular cancer, and try to hit it with the targeted therapy. Yes.
And with all this, we have seen that the survival of the women is prolonged.
Yes.
Now, we are seeing so many survivors now. We are seeing them surviving for 5 years, 10 years, 15 years.
Yes.
Definitely. So, all this advanced treatment is what is the reason.
We would really like to know some real stories that would matter to us. Yeah, some real breast cancer treatment stories, or Dr. Shrivali, yes, if you could tell us.
Yes, so I think, every cancer is different. So every patient is different. So it's very important to understand each one's story. And I think this is a platform wherein listeners can get motivated and say that, okay, when she can do it, why can't I do it? So I had a 45-year-old young lady who, was a non-diabetic but had some cardiac condition for which she was on treatment for the same. And she underwent a routine health checkup as a part of her package from the workplace. And the mammogram revealed 1.5 into 1.8 centimeter tumor in the left breast. And a biopsy was done. Yes, it said that there was an invasive carcinoma, and the histopathology was suggestive of this. And the immunohistochemistry, what we do, was a hormone positive. It was a strongly hormone positive left breast early tumor. PET-CT did not show anywhere else disease. So we sat on to a tumor board, discussed with our surgeon because she had this cardiac ailment, involved a cardiologist as well. So after optimizing the cardiac condition, she underwent surgery, and luckily it was just a T1C disease, N0 and M0. So she underwent a lumpectomy, removal of that particular tumor, and I think she underwent radiation as well, and she's doing extremely good. It's been more than a decade on hormone tablets, which also she's completed 3 years back. So I think yes, early detection is the key, and you can definitely have a normal life like any other normal human being.
And just like you and me, anybody normal can surprisingly come across a lump. So don't shy away. Just go out and get it screened.
Yes, get it screened, talk to your oncologist, be open about it, and get treated. Acceptance is one thing which we are finding it difficult. So I think once, yes, there is an acceptance, we can help them to get cured.
So on this Mother's Day special, I would like to tell you a story of a mother who was a first time mother. So she delivered a baby, and after delivery she noticed some lump. Now to the viewers, I would like to say pregnancy is a time where breasts are naturally engorged and they tend to become big, and lumps can often get undetected. Like उनको समझ में नहीं आएगा. They won't feel that is it a lump or is it the normal pregnancy related increase in the size of the breast.
Every mother who is a breastfeeding mother,
But
can
this-
relate to this.
Correct.
Yeah.
So this mother was quite intelligent, and she felt no, this is something hard lump in one particular quadrant. She came for a routine test and all that. We did everything, and yes, it was breast cancer. And let me tell you, she was devastated because she had just delivered a baby. She was breastfeeding, and now the question about how will my child live without breast milk. And she, as I told that there are many types of breast cancer, so she had triple negative breast cancer, which is actually among all the 4 types, this is the most aggressive type of breast cancer. I just told her, you have your child in your arm, you have to make it for this child. And on this Mother's Day, I would really tell you the strength of that mom. See, we as doctors give a lot of gyan and motivation to our patients, but we actually learn a lot from them. Even though I motivated her, but I really got that immense thing from her that wow, she really made it. And she sailed through chemotherapy. As I told you, that chemotherapy, immunotherapy, all are safe now. They're not much side effects. She had all her anxiety, this will happen, that will happen, but nothing happened. And she was young, she tolerated well, because the child in her arm kept her going. So she had to stop feeding, because you can't breastfeed when you're on chemotherapy. But there were other ways to maintain the nutrition of the child, the bottle feed, and the pediatrician was taking care. And it's been more than a year. She's disease free. And at the time of surgery, there was no lump detected. So that is called as pathological complete response, PCR. And she's so happy. She even kept her rosa in spite of me telling mat rakho, Bhagwan, I mean, Allah will not curse you. You just take care of your child on your health. But she did the rosa, and she's absolutely fine. So on Mother's Day, I think this story was really that made me special about her.
I think mothers, breastfeeding mothers, cancer survivors today watching us, fight your way. I think we have to fight our way out. Come out. Dr. Shobha, what about you?
Yeah, something different, if I have to say. I had a patient was diagnosed with genital cancer, and in 2008. So we got her treated. Then she completed her chemotherapy, radiation, and then she was on follow up. So she was diagnosed at the age of 55, around 53, 54. And then regular follow up from other cities. They used to come, couple, they used to come regularly. And then during the COVID time, from her town, she gave me a call. She said, my husband is having some lump in the breast. Then I said, how is it? Like, any lump in a male breast is definitely abnormal. I said, he has to get evaluated. Please get him to Bangalore. Then because it was COVID and it was, that time, we had lockdown, everything was, very restricted movements and all. But still, in spite of that, they waited for 1 or 2 months. Again, she called. She said, it's slightly increasing in size. And I said, you please don't delay. You come for treatment. Get it evaluated first. Then we'll see. Then you decide what to do for treatment. Then they came. We got him evaluated, and it was the breast cancer with the biopsy done. And then we told them the treatment, and they accepted it. He underwent the treatment, surgery, and then now he's on hormonal therapy. So I think 7 years over after the treatment, both are absolutely fine, touch wood, and they are very happy. They came and got it evaluated and then got it treated. So if by chance, if they would have delayed the treatment for 6 months and 12 months, because most of our women, when we ask the history, when did you notice this lump, they say it's 6 months, 8 months history, easily. So I think they are so happy now. They are thankful, that they made a decision to come and get it evaluated and then underwent the treatment. So this is something different, couple. She was a cancer survivor, and then him coming and getting evaluated and got treated. So it's a good story. Yes, yeah. And we do have a lot of sad stories, but but yeah, why that is more of due to ignorance, or they don't come forward for treatment. And one more lady who came with a bleeding tumor. The breast was totally hard, like a fungating tumor, and then it was bleeding. She had put cloths over that, and her daughter and son had come along. Then I asked, why didn't you tell your children? Then she was like, she was very, shy, hesitant. Then she was like, Nanninda avrige yaak tondre. So this is the thing what they say. I just thought it might, I took some tablets, it might go away for the pain she had taken. So that time it's very difficult to operate also. Those conditions also are there. Many come in that condition. So we always address our women not to come to that kind of situation. So anything early, any symptom, please come to your family physician also. Just go and approach and tell them the problem. Then next they will tell what to do. So Both we do have happy stories and then sad stories also.
I think happy stories always make us smile.
Smile, yeah.
But thank you for sharing these very rare stories as well. Male breast cancer, we've been reading about it, but I'm sure many of us haven't heard a case. And definitely a breastfeeding mother story. And ma'am, the story you said as well has definitely touched us today. As we come to the end of this conversation, what would be our final takeaways, ma'am?
Yes. So, yatra naryastu pujyante ramante tatra devata. Where women are respected, divinity blossoms there. So, I think self breast examination, start with a simple technique. Annual mammogram for those more than 40 years of age. Breast ultrasound for younger ones and those who have a strong family history, not to get scared. Go for a genetic counseling, check yourself, get detected, get treated, and definitely get cured. I think balanced diet, optimal weight, regular exercise, and a healthy lifestyle will definitely help us to conquer this disease. So, every woman who is listening to this podcast, we know you take care of everyone. So, this is the day you take care of yourself, and this could be the best gift you could give to yourself. So, on this Mother's Day, gift the other mothers, your sisters, daughters, children, your maids, with maybe a knowledge, definitely knowledge, and go for a health checkup. So, I think checking oneself and creating awareness will be the key to conquer this disease.
Beautiful.
Thank you.
Dr. Poonam.
So you take care of everyone, but who takes care of you? And you are the most important person in your life. You are the most important asset in your life. So all your jewelry, assets, property, money, bank balance, qualification, publication, whatever is their name, fame, is of no use if you don't have a life, right? So how do you live that? So be aware of your body. Make sure that you don't neglect it, because your body speaks to you, but are you listening? That's the question I want to ask you. Most of us are not listening to our body. We are just scrolling or putting loud music and partying. So let's start listening to our body. Body speaks a lot. And even be more aware, as Dr. Shivali told, get the screening done, checkups done. Because if you are not all right, then nothing is all right. And the fear which is inhibiting you to come forward to get the checkups done, that fear, I think, is the real cancer in our minds, which keeps you stuck and doesn't allow you to come for even a simple checkup. So let's combat the fear and let us empower each and everyone, whoever is listening this podcast, empower another 10 to 15 or 20 or 100 women, that yes, I will go for it and I will not wait for it. Thank you.
After hearing you, I certainly will go for it.
Thank you. Thank you. Done.
Job done.
Job done.
Mission accomplished. Yeah.
Dr. Shobha, we would like to hear from you.
Yeah, so both my friends, they have put beautifully whole thing, summarized the whole thing, whatever we wanted to tell you. So when you were a daughter, your mother took care of you. And now you're a mother, you will take care of your daughter. But mothers, who is going to take care? So first think of yourself as a person, as a lady. Take care of yourself. You don't, I mean, others can take care of themselves too. You don't have to always be there for them. So be there for yourself, live for yourself. And as my colleagues put, so don't ignore any symptom, any problem in your body, listen to it, and then come forward, express it. So be natural with it. You don't have to feel shy. First thing is shy, of course. Then most of them, they fear, what if I get an abnormal report? So what? So what? If it's abnormal, you have solution for that. So you don't have to fear of getting something abnormal. So at least you can treat it early and then get rid of it, instead of waiting until it becomes huge and incurable. So please, all mothers, so do take care of yourself, be happy. So happiness is the one where all half of your diseases is it vanishes with a smile in the morning and before you go to bed. You smile for yourself that you're happy, contented in what you're doing. So that makes a lot of difference. So thank you.
As we come to the end of this conversation, I would like to leave us all with one simple thought. We women are always available for our children, our families, our loved ones. But remember that our health, your health, matters just as much. Breast cancer should not be feared. Do not fear breast cancer, but understand it, detect it early, and act on it. Detected early, breast cancer can save families, it can save futures, and it can definitely instill life, save lives, and give a ray of hope. So, this Mother's Day, give yourself a promise. Listen to yourself, do not ignore the signs, make health your priority. Because when you take care of yourself, you're able to take care of everyone. So, let's keep this conversation going. Happy Mother's Day.